Thank you, David. Our speaker today is Rebecca Roesslet, who became the director of Columbia Boone County Public Health and Human Services on October 7th, 2024. She previously served as the assistant director beginning in May 2022. Roesslet began her career at Public Health and Human Services in 2003 as a social services supervisor, a position she held for 10 years before becoming a senior planner in June 2013. As assistant director, Roesslet was responsible for day-to-day operations of the Department of Public Health and Human Services, management of personnel, both directly and with a team of managers and supervisors, assisting with financial management, and collaboration with Boone County to deliver services in the county and assure department compliance with local, state, and federal policies, ordinances, and protocols. Excuse me. She became a public health planning supervisor in November 2020, leading the epidemiology and disease containment branch, overseeing disease investigations and contact tracing. We certainly heard a lot about that during the pandemic. This role also included coordinating the Community Health Improvement Plan and working closely with local partners to identify public health needs and gaps. Rebecca previously worked at the State of Missouri's Division of Family Services from 1995 to 1998 and the Division of Senior Services from 1998 to 2003 as a social worker. In these roles, she provided case management for children, families, and older adults and those with additional needs, referring them to local resources and investigating reports of abuse, neglect, and exploitation. She earned her BA in psychology from the University of Missouri in 1994 and her Master's of Public Health in 2012. Rebecca recently earned a certification from the Harvard Kennedy School of Executive Education Leadership in Crisis in 2024. That seems especially relevant right now. Welcome, Rebecca, and you have the floor.
Thank you so much. Okay, let me share my screen. Okay, everybody, thumbs up. You can see that?
Yep, works great.
Okay, wonderful. So, thank you for the introduction. I pulled that from our webpage and it kind of sounds as if my mom wrote it, like there's a lot of very favorable things. So I might need to trim that back a little bit in the future. So as mentioned, I'm Rebecca Roesslet. I am the current director for Public Health and Human Services. I've been with the department since 2003 and have held many different roles. So today I'm just going to talk a little bit about what public health does, what we're keeping an eye on at the national and state level, more of a current events, and then we can spend some time talking about public health funding because that is a very timely concern that we have right now. Oh, let's see, hang on a minute. There we go. So this is our building. We're located at 1005 West Worley. We're in the old Knowles grocery store. On the other side of our building is Compass. And so we really like our location. We're in Central City. We're on a bus line. We have free parking. Many of you may remember we used to be downtown and it was a lot more challenging for our WIC families in particular to come for their WIC appointments when you've got parking's a little bit more limited and you've got babies and strollers. And so we really saw an uptick in foot traffic and WIC participation when we moved into this building. And that was in 2004 that we moved into our location on Worley. So right now we have about 105 FTEs, that's full-time employees. When we moved into the building in 2004, we had around 65. So we've had quite a significant increase in our workforce, partially due to the pandemic. When COVID-19 happened, it became very evident that public health did not have a solid infrastructure to respond to a pandemic. And so a lot of funds came down from the federal government to the state and to the local health departments to really grow our capacity and to increase our infrastructure for a public health response. So we've seen a pretty significant increase in our staff in my tenure here, so over the last 20 years. But like a lot of health departments, we have nurses, we have health educators, we have animal control officers, which is a bit unique in Columbia, Boone County. And animal control falls under public health because it's really about rabies and preventing injuries from animal bites. We have nutritionists, billers, environmental health inspectors, lots of different types of professionals can find themselves a spot in public health. So this is just a little bit of some of the services that we provide. One thing I'd mention about animal control that I always try to remind people when I do any kind of speaking is that if you should find a bat in your house, please keep it there, close the door, call animal control. We'll have an officer respond. They will collect the bat and then they can test it for rabies. And also I like to stress the importance that even indoor cats need to have their rabies vaccinations be current, because we do have bats in our community and sometimes those bats do have rabies. So that can be a risk that you can avoid at home. So we offer a lot of vaccinations like most public health departments. Our WIC nutrition program is one of our key functions. We serve about 1,800 WIC families a month, and WIC is a nutrition program. I'll talk a little bit more about that later in a different slide. We're also the place that you come if you need a death or a birth certificate. We have a contract with the state of Missouri to offer that service. Someone pointed out to me the other day that you may not think you ever need public health, but if you want to add your newborn to your health insurance, you have to come to the health department to get your birth certificate. So that was just one of those normal everyday things that we do that provides a service to our community. We're unique in that we have social services specialists here in public health. That's not something that you see across the state. So our social services staff, they can help someone apply for food stamps or Medicaid or find a medical home if they don't already have one. We do a lot of pregnancy testing, counseling support, prenatal case management, utility assistance, just to name a few things. Medication assistance, we help with a lot of chronic disease medications. As you can imagine, when other things become more expensive, such as your food cost at the grocery store, then sometimes you have to prioritize other expenditures. And unfortunately, sometimes someone's high blood pressure medicine or their diabetes medicine could be the thing that they opt not to purchase because of cost. So we're very fortunate in that we do have some funding to help with the purchase of those types of medications. We do a lot of education. Public health is very focused on prevention and education. Communicable disease surveillance. So there are many different conditions that are considered a reportable condition, and that a medical provider or a lab, if they confirm a case, they have to report it to the local public health agency. And then usually the reason for that is to ensure safety of the community. So botulism, for example, if there's a botulism confirmation, we need to know that so we can try to identify the source of the botulism and reduce the likelihood that somebody else is going to have an exposure. COVID was a reportable illness. Measles, mumps, those are all considered reportable illnesses that we have a responsibility to take some type of action on when we receive them. And then we do a lot of planning, as you can imagine, like a lot of government entities. So environmental health, this is something I just like to highlight when I speak to groups, because as I mentioned with death and birth certificates, a lot of times folks don't really see where public health touches their life. You know, if you have never received WIC, you don't have you get your shots at your doctor's office or the pharmacy, and you never have a reason to need to come to our office, you don't really think that public health is something that it's a service that you use, but you do. So if you have a child in daycare or a school, or if you've ever shopped in a grocery store or a convenience store, or you eat in any restaurants in Boone County, somebody from our staff has been there before you to make sure that the food is safe, that the ice machine is properly cleaned, that the school lunch is holding the food at the correct temperature, and that things are labeled properly, so that, you know, we have staff that inspect tattoo establishments. So a big part of what public health is doing is this type of regulatory enforcement, kind of the behind the scenes work, to make sure that the public is protected from things like disease outbreaks as a result of food or other contaminants. Okay, so current events. As you can imagine, we are keeping an eye on measles. Let me move this for just a minute because I've covered up my slide. Okay, these numbers may be just a tiny bit old. I pulled them off of a Google site where we keep information. But as we all know, there's been more than 800 confirmed cases of measles in 25 states in this calendar year. 85 of those have been hospitalized with 3 confirmed deaths. So locally, you know, with measles vaccines, we're looking for herd immunity to really have an idea of what the impact of a measles case might have on our community. And vaccination rates in a community that are at 95% or higher are considered to have herd immunity, which is necessary to help protect individuals who cannot receive a vaccine. Boone County is currently at 95.15, which is getting really close to that 95%. So here is, I pulled this from the state's website, and the link to this is in the prior slide, if anybody would like to look at it. So the state of Missouri kindergarten vaccination rate is 90.14, which is below the necessary herd immunity threshold. In Boone County, we're at 95.15. And then the vaccination exemption rate is 2.34. So in Missouri, families can request an exemption for vaccinations. It's typically requested for religious reasons. And we don't do those at our office. We refer families to the state health department if they would like to request a vaccine exemption. So in Missouri, we've had 2 cases and 1 exposure. So there was an exposure of somebody who was visiting the aquarium in St. Louis, and they had measles at the time of that visit. And then we've had 2 cases of Missouri residents. Actually, one of them may have been a visitor to the Branson area. I believe that was a child. And then there was an adult as well. So pretty small numbers still in Missouri, thankfully. But we are already, I mean, we're meeting regularly internally just to make sure we are well prepared for our first measles case. We've set aside resources. We've pulled information from other communities that they have shared. Basically, you steal information from other health departments if you really like how they did a press release or some educational information. So we're doing all the things that we can to be as prepared as possible. Sometimes we get requests right now from individuals who are wanting to know, should I get a booster for measles? And this is just a nice flow chart that Springfield Green put together that we found to be pretty helpful for individuals. Okay, so let's talk a little bit about our funding. So we are a city-county health department, and which is unusual. I'm the only city department that provides services outside of the city limits. So within the city of Columbia, we are funded by what's called the general fund. In the general fund also is police, fire, public works, some of parks and rec. So it's one of the largest expenses to the city. The county, because we provide public health services in the county, they pay for a third of our budget, just for public health budget. We also receive a significant amount of federal dollars that are passed through the state health department. We have some revenue from fees that we charge to those that use our services. But right now, you'll see a little later in the slide, our FY24 federal state contracts were about 4.5 million. This year, they're closer to 5.5 million. So we have roughly a $16 million budget as a department, and a third of that comes from the federal dollars that are passed through the state. So it's a huge part of our funding structure. Public health funding, I know there's public health people on this call. This will be no surprise to you. Missouri has the lowest public health funding per person in the United States. We are at $6.67 compared to Tennessee, which is significantly higher. This pie chart shows you kind of just a breakdown of our city general revenue funds versus fees, the money that we receive from the county, and then, as I mentioned, the grants that we receive. So we have been watching very closely some of the changes at the federal level, because that impacts the money that the state health department receives, which impacts the money that they pass on to the locals. So in the proposed federal budget, and these aren't, final at this point, but there were some pretty key reductions in federal funds that would have a direct impact on the services that we're able to provide here at Public Health. And I'll go into a little bit more detail on that. Okay, so our funding service areas we kind of lump this together into 5 key service areas. So we have women and children, violence prevention, mental health and substance use, HIV and other sexually transmitted infections, and other public health services. These are all service lines that are supported by funding other than the funding we receive from the city and the county. And just to clarify, because I had an internal discussion recently of, kind of how have we gotten to this point where we are so reliant on other funds other than what we receive locally. And the point was made to me, and it was a good point, that this system has worked very well for us for a very long time. And we have a responsibility as a governmental entity. If there are funds that we can use that do not draw from our local tax base, we should use those funds. So it is important that if there's other money that I might be able to try to draw from to support the operations of this department, I should be using those first whenever possible. So although it may feel like we have an over-reliance on federal and state dollars, it's also us being good stewards of the city and county resources that we are using those dollars instead of pulling from the general fund and the county's finances. So that kind of helps shape how I think of our funding predicament that we're now in. Again, the system worked well for many, many years. It's just right now, it doesn't feel like it's going to work so well. So the potential funding loss that you'll see at the top of these slides, this is just you know, if we were to have a complete wipeout of all federal dollars, this is what it would look like. We are not in a position where we think that's going to happen. This is kind of a worst case scenario. But this will give you an idea of some dollars and what exactly we're able, the service lines we provide with those particular things. So this first slide in women and children, you know, where that includes our WIC program. WIC is a nutrition program that provides vouchers for healthy foods for pregnant and breastfeeding women and children up until from birth until age 5. We also, that is a USDA program that is passed through the state to local public health agencies. And in the WIC program, we serve about 1,800 participants a month. And that money in turn then goes into our the revenue received at local grocers. So those are WIC vouchers that the family is able to receive to offset their grocery costs. Then there's also a benefit to the grocer because they're able to then spend their voucher at that store. So we also do childcare health consultation, which is where we have nurses that provide training for childcare facilities in Boone County. We do cancer screenings for low-income women. So we participate in a program called Show Me Healthy Women, which helps cover the cost of breast and cervical exams for uninsured or underinsured women in Missouri. We also have home visiting for pregnant and parenting families who have some socioeconomic risks related to healthy birth outcomes. So in the who is served, this is just a snapshot of who WIC serves. So of the 1,800 women, infants, and children who participate in WIC each month, 15 of those families are unsheltered. 39 of the mothers are under the age of 18, and 100 of the children are children who are in foster care, and their foster parents receive WIC on their behalf. So violence prevention, this is really looking at a grant that we have that is a sexual violence prevention contract. And that's really looking at how do we improve our system and our collaboration to reduce the instances of sexual violence. This is a pretty new grant to us, but we've been working on it for a couple of years now. And this work is really focused on adolescents. Mental health and substance use. So this is a pretty sizable one. You'll see a 1.7 million. Part of that, this includes our community paramedic program. And this is a grant that we received from SAMHSA. And it's a partnership that we have with MU Healthcare. And if they respond to an overdose call, it allows for them to leave a paramedic behind with the person who experienced the overdose after they've been stabilized, of course, to help refer them into treatment options if that's something that they're open to. So that's a pretty sizable grant. It also helps cover the cost of all of our Narcan supply and education that we do throughout the community. And I am happy to report that the data shows that our overdose deaths have been decreasing. Narcan is a very effective prevention tool. And, you know, Narcan allows someone to survive that overdose so that they can at some point seek treatment. So it's something we're really passionate about, and we're really happy we're able to offer that to the community. HIV and other sexually transmitted infections. This is also a pretty sizable grant, 2 million for the entirety of our HIV services. HIV is something that we are very passionate about here in public health. We have a sizable contract from the state to provide HIV case management services. We provide that over 37 counties in the central region. Same with HIV testing and prevention. We started the HIV case management program about 2 years ago. It used to be done by another agency in town, and that agency was ending. And the state requested that we take it on, and so we did, and it's been a really good fit for Central Missouri because we're kind of through the lifespan of HIV services here. So we do prevention work, we do testing if you're someone is positive, we do the partner notification, and then we do prep and post-exposure prophylaxis, and then case management. So we're really kind of a comprehensive approach to HIV in Central Missouri, which we're very thankful to have this resource in our community. And then other public health services. So this is really looking at, we get a little bit of money from the state health department that is just state dollars, and that's for our core public health funding. So core pays for things like the work that we do for tuberculosis. There is still quite a bit of tuberculosis. Most people don't think of TB anymore. We think about it a lot in public health. Excuse me. And we have 3 full-time nurses who focus exclusively on tuberculosis case management and latent tuberculosis infections. So we also receive a little bit of money for emergency preparedness planning that came about as a in a post 9/11 environment. A lot of public health dollars were used for emergency preparedness. So our FY 2025 total for state and federal grants is 5.4 million. So it's pretty significant. Okay, I'm going to stop sharing and we'll just talk for a minute about some of the recent changes we've had. Oh, good, Michelle's here. I couldn't see any of you when I was presenting, but now I can see all your faces.
Sorry about that. Hi, my name is Michelle Scheichels. I'm the assistant director here. And yeah, I hopped on probably, I think, right at the beginning of the presentation. I was coming from something else. So good to see you all and happy to be here.
So let me just talk a little bit about changes we have seen in, gosh, just this last week. So, and this is not secret information. We just, our staff are aware and we've made our executive leadership aware. So in the last week, and Michelle, step in if I overlook anything, we were notified from the state health department that our public health emergency preparedness money, we were going to receive half as much as we have been receiving up to this point. It's actually like, what is it, 50.1%?
Yeah, but still over the 12-month period.
Yeah. So the public health emergency preparedness money, as I mentioned, we've had that since post 9/11. And that currently pays for our emergency preparedness planner as well as our public information specialist. Michelle, I'm going to let you talk for a minute while I get a piece of candy.
Yeah, that sounds great. And our public information specialist is our person here that answers all media inquiries and puts out the press releases, and especially in an emergency would be doing a lot of communication with the public to make sure the public stays informed. And so, yeah, that was a big change to be notified that half of that funding would be going away. Like many things that we're hearing about right now, the state is kind of in a situation where they're like, we're unsure if the federal government is going to give us more later. We'll keep you posted. And so with a lot of different areas, we're in this waiting period where the state unfortunately doesn't know. So they're in a tricky situation. And we're all just waiting to hear more so we can make sure we take the correct plan of action. Do you want me to keep going?
Okay. Yeah, if you don't mind.
Okay, sure. The other thing that we were made aware of is our Healthy Families America contract has ended. That is part of the maternal and child health funding that we receive. Maternal and child health on a federal level um, is a sizable amount, and they give good portions to each state, and then each state divides them up for different programs. And one of the programs that we had funded under that MCH fund block grant was the Healthy Families America contract, and this contract is for evidence-based home visiting services, really serving our most at-risk moms. And Rebecca talked about how we as a community are trying to address community violence. This program has shown to decrease violence and increase vaccination rates, increase the use of prenatal care, reduce child maltreatment, decrease the rates of premature and low birth weights. So very, very, we believe it's very important. It's investing money in a small group of very high risk individuals in order to make a big change. And we were notified June 18th, so just a couple days ago here, that that program is not continuing. So we will not be able to continue. The state will not be able to continue funding that program. Now, that's a program that as a community, we have said that that's a priority and we want to keep funding that. So we do have some city dollars, but we're definitely going to be at a deficit in that program now, about $147,000 in deficit. So, yeah, that is one that was cut. And then let's see, emergency preparedness. We talked about that. And then HIV prevention. So HIV prevention, we were notified June 17th. So again, this week, it was a busy week for us, that we would no longer be receiving HIV prevention funds. We've received these funds for over 20 years. They really are kind of a core component of what we do. It's a priority for public health to prevent the spread of infectious diseases. And particularly with HIV, it has a very big impact on the individual and also the community. So that's always been a priority for us. And we serve 37 counties, but the vast majority of the cases are in Boone County. And with this, we were notified, like I said, on the 17th, and I think our meeting was at 3 p.m. that day, and they told us that we could not incur any other costs after 5 p.m. that day. So very, very short amount of time for us to really plan and do anything for that. But we are, all of these programs are funding staff. And so until we know the extent of the impact, we're trying to maintain our staff and limit their duties to Boone County. And we're going to track these expenses and really try to make a case later on to the state and to the feds for them to reimburse us if they do decide to unfreeze these funds, which again is all unknown. And then our last one was our rural prep. And our rural prep is pre-exposure prophylaxis, and we have a clinic for HIV rural prep in this area. We are considered rural, and so that's why we qualify for that funding. And this allows us to provide pre-exposure prophylaxis, which can prevent the spread of HIV. So if somebody's at high risk for HIV, our goal is that they don't get HIV, right? And one way we can do that, and one way that we have found that is very effective, is by giving them this pre-exposure prophylaxis. And so this clinic is designed for people who are at high risk, who do not want to get HIV. They can come to our clinic and receive treatment and medication. And we also follow some of their labs as well to make sure that they're tolerating the treatment. And yeah, so this was, like Rebecca said, just this week. But it's been a journey for us. Our first round of cuts happened a little while ago now, maybe 2 months. Is that right?
March. Mhm.
March. Okay. And that first round of cuts was over 800,000. And that cut a lot of programs that were chronic disease prevention. Some were in response to COVID, and then programs created to promote vaccination. Some of those we kind of expected with the new administration. And then some of them we didn't. That chronic disease we thought was going to be a priority for this administration, but this funding was cut. And so we're trying to do our best to guess, but we can't always guess what's going to come next. And we're planning for a lot of different models with what's going to come next and how then we can use those limited funds to serve our community best.
Michelle, can I interrupt? We have a question for clarification.
Yes.
On the cuts of the HIV services, what was the original source? I think it was something federal.
Yes, federal. Yeah, these were federal HIV prevention funds, and they're
From the
actually
Department of HHS or?
Yes, yes. And it's actually like three different pots of money. One is called HIV prevention. One is called ending the epidemic, which is a fairly new pot of money. It was created during Trump's first administration, and it almost doubled the amount of prevention dollars that we had during that time. And then the other pot of money that it's coming from is expanding testing. So really working with hospitals to increase HIV testing for those at risk.
Alice, to answer your question, there is not a slide with the cuts. We just notified executive leadership and our staff today. So,
Okay,
Hot off the press.
yeah.
Hot off the press.
unfortunately,
I see. Okay, because
um,
I plan to send this recording to Charles Dunlap with the Tribune after it comes out. And so, of course, I hope he has questions for you.
mhm, okay. And
Can I-
then
Can
you
I
also had a-
interrupt once
Yeah.
more to welcome the people who have joined us? I know we have one state legislator from District 50, Greg Bush. Do we have members of the press here today? I don't have anyone interfering or identifying themselves, but
Hi,
as
yeah,
Alice
sorry,
said,
I'm
yeah.
here.
And you're from what
Hi.
organization?
My name's Kiriana Gambo. I'm with ABC 17.
ABC 17, you're very welcome. You're welcome to ask questions too. We haven't actually gotten to the formal question part yet, so I will return it now to Rebecca to and tell her that we're eager to ask questions.
Well, I was just going to answer one of the questions in the chat. Alice had asked about measles vaccines still covered. As of right now, the answer is yes. What we are wondering is, and I haven't seen any strong information on this one way or the other, but if vaccines fall out of recommendation schedules, then I am concerned that insurance companies won't pay for them. Because if it's no longer part of, your recommended or required, then it could be considered a cash purchase. So that would be a pretty tremendous access issue for a lot of folks. But we're just keeping an eye on that. We don't have any hard evidence one way or the other at this point.
It would be, Rebecca, more similar to COVID right now, which isn't probably being covered for pregnant women and young children, right?
Yes, I'm not sure if insurance has stopped covering it, if you're no longer, I don't know what the specifics on that. Do you, Michelle?
Yeah, so insurance is still covering it. Most insurance are still covering it, but we expect that to end. And yeah, this will be a really unique situation that we'd have here with vaccine recommendations, in that they typically align with what our medical community has as recommendations. And so now if the administration differs, I think these insurance companies are going to have to kind of decide if they go with with what the administration is recommending and only covering those, it's going to put people in a lot of tricky situations because their provider may recommend one thing, but their insurance may not cover it.
I think we're ready for questions.
People will raise their hand or do it electronically. I have one question already put into chat by the ABC 17 reporter. Do you see that, Rebecca?
I do. And Michelle, jump in if I have this incorrect, but the discussion around clawbacks, I feel that that conversation was related to if the city was not in compliance with executive order, then the feds could do an investigation and could claw back dollars already received by municipalities. That's a different scenario than what we're talking about now. Because we have not been out of compliance with anything. It's just simply the federal budget is no longer choosing to prioritize some of these areas that we've long received funding in. Clawback tends to be a term used if some condition has not been met, then they pull money back from you. Whereas ours is simply the funding is just ending.
And I think clawbacks have gotten quite a bit of attention recently, because one, they're not typical. But two, there has been like the new threat of if there's any violation, we'll be clawing back all your funding. And sometimes they even include funding you've already spent. And so that could be very detrimental for the city and of course our department. And just in general, our state and federal partners have been very thorough and sometimes almost setting new standards with what they want from us in order to receive funding. And I know the state is just responding to the Fed's request as well. So they're just acting as a middle person there. But yes, it is even so the funding that we maintain and the funding that we continue to receive, we're having to provide additional information, more clarification, all that in order to get the amount we spent reimbursed.
Marie Scala.
Hi there. Good to see you both. My question is kind of a follow-up to the discussion about vaccinations and the concern about insurance coverage. But could you describe how the health department provides vaccinations to the public, what the funding stream is for that, and whether that too is in danger?
Do you want to take that one, Michelle, or do you want me to?
I can take some of it. You can fill in the gaps. So we do have some funding for vaccines. As we already mentioned, we had some funding for vaccine education, vaccine promotion, and to go out into the community and provide vaccination. So it wasn't actually for the vaccine itself, but it was for nurses to drive to people's homes who couldn't leave their home to provide a vaccine, or to different areas of their community where there is a higher need. So that funding we have already lost. We do also receive funding through a stream called Vaccines for Children. And so that's one that we're watching closely and really monitoring, particularly with some of the discussions now about what vaccines children need and don't need. Yeah, and then we also do take insurance for vaccinations as well. Rebecca, do you want to add anything?
You pretty well summed it up. I think one of the key things with vaccines, there's some nuances to just being a provider who keeps, stores, orders, maintains a vaccine inventory. And I mean, our vaccines are probably the reason why we have so many generators in this building. Like, it's expensive to be the keeper of vaccinations, and it's long been a public health function. And so if changes happen that really impact insurance coverage of vaccinations or any changes to the vaccines for children program, that is severely going to limit the number of providers who are even storing and offering vaccines. So that's going to have a big impact on access, just physical access, like where can I take my child to get their kindergarten shots? So yeah, as Michelle said, I mean, we watch the news as closely as we did during COVID just to see what is next, what's happening. What are we hearing from other public health agencies? What are other states seeing? And that's certainly something that we have worries about.
Alice has a question saying, how does your work interact with Compass? And I suppose she means other healthcare providers. And do you know if their funding is also at risk, such health providers that provide community services? I think that's opening up a whole area that I was wanting to ask about too, is your relationship with others. I was going to ask about Mizzou and other colleges, especially STI and pregnancy, that the interactions must be tremendous within this field.
They are. And those relationships that we had going into the pandemic really had a hugely positive effect on our ability to respond to COVID in the manner in which we did. And so in a post-pandemic environment, we still work very hard to continue to curate those relationships, make sure that we're maintaining a touch point between us and student health at Mizzou, and that we, you know, speak regularly with our hospitals and we and the schools. I mean, public health is a natural convener. So oftentimes we aren't the ones leading the charge. We're just the ones who pull all of the interested parties together in the room to work on an issue. So we maintain a lot of relationships. I don't know about funding for Compass. I think anything that is receiving federal and state dollars is a little, probably feels the same instability that we're feeling right now. But truthfully, I've been completely laser focused on on our functions. And we have been watching a little, you know, I am worried about Medicaid.
Yeah.
Because that is a tremendous resource that our residents really need to help them have healthy lives.
As a point of personal privilege, I will tell you that in March 2020, I returned from Europe, came down with COVID, and was patient number 7 in the county, patient number 2 at the Mizzou new ICU for COVID. And I was one of the few from that area that did survive. And it was your office, and I think someone at the state, who helped me get where I had to get in time to save my life. So everything will come back to you, is the way I see it. And yeah, Compass and all these other people, we hope they're doing their job and you're trying to get ready for whatever adjustments have to be made. That's the picture I'm getting from you at this current moment.
Yes. David, you've had your hand up for a minute.
Yes, my question, you have a $16.1 million budget, and you're at risk of losing 5.4 million. Now, is all of the rest, is some of that, is there some money coming from the state? Or is it city and county entirely that is paying the remaining amount of money?
The remainder is overwhelmingly the city and the county, and some money that we receive from fees. And as I mentioned, with the city, we share the same part of the budget as police, fire, and public works. So, you know, that is it is not an unlimited pot of money. So part of how we've been very lucky to even have access to these grants so that we could grow and expand and provide more services without having to reduce the amount of funds available to police and fire and public works.
So the state has not been contributing anything out of its own funds, and
The state, go ahead, Michelle.
Sorry. So the state contributes very little funding to public health in the state of Missouri per person. The state could actually double what it's spending per person, and we would still be the most poorly funded state when it comes to public health. So they do have limited funds that they can use to operate themselves, and even fewer funds that they can distribute out into the community. That being said, there are a few grants that are funded with state funds. One of them that we have is our core grant, and that is true state funding. And it's a few $100,000 that they provide us to do TB testing, birth and death certificates, things like that. And then the other one is actually a new grant. It passed a couple years ago. And that one is for our grant targeting fetal and infant mortality. And with that grant, we will have a fetal and infant mortality review board, which reviews fetal and infant death and really looks at all aspects of their environment, their situation, their health that contribute to that death, and then help us try to prevent that from happening again.
I just want to add I'm a historian of Europe and a historian of science. And people don't understand that our modern life, and especially our longevity and ability to live without disease for the most part, at least for a long time without it, results not from medical research or medical breakthroughs, not very much, but from public health. But also, historians are aware that from the very first cholera studies in London in the 1830s or 40s, I'm trying to remember exactly, that there was always a lot of public resistance to public health, that it is a political area that is saving us and not the scientific medical area. But these are the people who have to apply this and deal with the public. So I don't think people realize this. They think it's doctors and modern medicine that saved them. It's public health that saved them. And I don't know what we can do to make this clearer to people, that when people call you from the public health, they're not messing in your business. They're actually trying to bring you into the modern world where you can live a safe and happy life.
Rebecca,
David,
did you
we're going to
pay him
start
to say
traveling with
that?
you. No, but my goodness, thank you.
Taylor has written his frustration that our state government hasn't been able to be more active. What could we do as citizens? I mean, that's connected to my statement too about the vast importance in the history of the world of public health, and ongoing, if you think about other parts that are now not being served by USAID anymore. That we really are at an impasse. And I'll add one more piece of personal information. I went to Harvard with our Secretary of Health Education, or Health and Human Services, and I actually knew him because my roommate was a drug dealer. And all the things that, I don't have any comment on any of the things that you've heard about him. It's quite consistent throughout his life, poor guy. I don't know what we can do. We're a political organization. We want to try to move things if we can. What more besides supporting our friends like Greg can we do to draw attention to this, or do you want us to draw attention to this threat to public health?
Go ahead, Michelle.
Yeah,
This
that's a
is-
really good question. And again, I feel like we're in kind of an interesting time in that often it's people that we're serving that will say, oh, then they're also against public health. You know, they don't want public health to intrude on their lives, but they just want to get their WIC benefits. You know, so it's like this, it doesn't always like make sense in our mind. But we know we have to do a better job at communicating what we do and communicating in a way that is bipartisan and try to use words that have not been, you know, marked this wing or that wing. And it's been hard because that's been changing a lot. And so we are still learning how to best do it. And yeah, I'm not sure. What, Rebecca, do you have more to add?
You know, Michelle and I work in government, so we tend to stay, we love anybody who wants to advocate. It just can't be us.
Yeah.
So I think I mean, the data speaks for itself. Missouri has very low public health funding. What do other states do to fund public health? Is it part of their tobacco tax? Like, there are key things that other states that do fund public health at a much more reasonable level have put in place to set that structure up for success. Yeah, and you know, for at the local level, it's tough. As I said, there's not an unlimited amount of money, and if you give more to this for, you know, streets, which are really important, you have to take it from somewhere. Are you taking it from the fire department? Or are you going to take it from public health? Like, we are in the general fund, you know, are you going to take it from some of Parks and Rec? Because their dedicated parks tax does not pay for the entirety of their operations. It pays for the parks themselves. So, you know, as a municipality, we're a little bit in a tough spot as well. The city and the county support public health. Michelle and I feel very supported by leadership. And we want to be a community where we are taking care of people. And I love everything you said, David, about public health. Thanks to us, you wash your hands while you sing happy birthday in your head and you wear seatbelts. So, you know, public health has had some pretty big wins over the centuries. And we would like to see that continue. And the system is just not well set up right now to support public health, and that any help you wanted to provide, we would not be mad about.
But I thank you for reminding me of that essential point that you and your staff are in the government. You cannot advocate politically. Others can do that. That's
Right.
a really important point.
Yeah, we want to keep these jobs.
But if you can keep the information quite clear for us, what we
Mhm.
need to know when we advocate, then that helps, I think.
Yeah, and we do have limited advocacy organizations that do a really nice job at conveying maybe the public health perspective on different
Right.
things that are going through. I know that question was just asked. And so right now we have in Missouri, we have the Institute. I believe they changed their name. It used to be Mosifi and now,
Mhm.
yeah. So the Institute of Public Health. And then we also have national partners, Heart, Lung, and Cancer Association, and people like that are not solely public health focused, but usually if there's something involving public health, they're on the same page as the public health folks.
And, you know, we're a large city county health department in Missouri. We're in probably, are we the fourth or fifth biggest? So I think if there's something that's gone really well in Kansas City, St. Louis, Springfield, Greene, they all work in the same state of Missouri. So maybe they've done something at a local level that we can look at doing ourselves.
Maybe we can let Kathy Jensen have our last question today. It sounds like you guys are busy and we should let you get back to work.
I don't know. This has been kind of fun. We're not always in spaces where everybody's so pro public health. So this is kind of a nice treat.
Yes. Well, my question was to ask Greg Bush, say the group, whether public health was one of the issues that new legislators were provided an orientation to. And if not, maybe there's a way to do that.
I think he jumped off. We should have
Oh, darn.
stopped talking earlier. Sorry about that.
Okay. Well,
Yeah,
I'll follow up
he's
with
not-
him and
Yeah, it's not typical for Greg to avoid something. Something must really have come up.
Well, if there's anything that you all need from Michelle and I, we are happy to provide.
Right.
Thank you for
Right.
asking us to come
Yeah,
today.
thank you so much. We enjoy every opportunity we have to speak to the public. So thank you.
Thank you.
Thank you.
Thank you so much.
this was really great. I very much appreciate it. And I'm wondering if I would be interested in reviewing your slides at more depth because I couldn't get everything read. Is there a way to see those?
Can I email them to you?
That would be wonderful.
Okay,
And
happy to.
would-
And then
Would you consider adding a little bit on the cuts that you know about? Because I do want to send that to the press to see if they will cover. So if you add that and send it to Kathy later, we can share it and see if we get more outreach to the public through the media.
okay. Thank you for the suggestion. Okay, thank you guys. We appreciate it.
Thank
We
you so
appreciate
much.
you. Thank you.
I had one short question. Do you still give out free COVID tests?
I think we have a very limited supply. Michelle, do we have any that we're giving out at the front desk anymore?
I mean, it's so limited that I would have to go check to see if there's
Yeah.
still some there.
Okay,
Yeah,
Okay.
it's a really dwindling supply, and
I bet.
we don't anticipate getting more. It was something we were getting
Sure.
for a while there.
Okay, thank you.
Thank you all so much. And